Well, good afternoon and welcome to the Bipartisan Policy Center's webinar on what we know, don't know, and should know about the childcare workforce. My name is Linda Smith, and for those of you who don't know me, I am the director of the Early Childhood Initiative here at the Bipartisan Policy Center. I want to thank everyone for joining us on this journey to take a look at what we know about our workforce and the challenges that we're facing. Today, we're going to basically step back from this and begin to examine some of the data that we have. We will be issuing a report in conjunction with the National Workforce Registry Alliance. It will be posted today on our website, but more about that in just a second. I want to look back and say, a few things about why we're doing this work. The title of the report is intentional. What we know, I can tell you some of the things we know. We know that we have a low-paid workforce. We know that the work is hard and it is intense. And if children are going to get what they need the workforce that is trained and competent. We know that we have a high turnover rate in our childcare programs. We know that we have difficulty recruiting qualified workers. And we know as a result of that, we have empty classrooms around this country because we simply cannot recruit the people we need. So at a time when we have such high demand for childcare in this country, to have vacancies is something that is unacceptable. So what don't we know about the workforce? Well, we actually don't know how many people we really need. How many workers do we need to fill those classrooms and expand the availability of care to our families? We don't know much about the current workforce, and we found that out through the work we've done on this report. How do we raise the pay of the workforce, and how much will it cost us? We don't know the answers to that. So what do we need to know? Well, one of the things that we did for this report was take a look at 10 basic facts that we think we need to know in order to make this, to make progress in getting the workforce that we need and our children need and deserve. So what we did, building on the report we released in February of this year called Top Down, Bottom Up, where we laid out a 10-step plan for states to develop a system of improving the childcare workforce. In that report, we put 10 steps. The third step in that report was basically to collect, analyze, and utilize workforce data. And that's what got us to this point today and why we did this report. So I want to back up and just give a shout out to one person that I think really deserves a lot of recognition at the national level, to Ivelisse Martinez-Beck, who has been the mastermind behind the National Survey of Early Care and Education in this country. And that survey has actually given us a pretty good idea of what we have at the national level. But we know that the macro facts only are good so far. And what we really need to understand is what's going on at the state level, where this really where the training and the financing of this will really take place. So to begin to understand that, we partnered with the National Workforce Registry Alliance, and we took a look at 10 basic facts that we know about each state's workforce data. Kimberly is going to give an overview of the NWRA and the registries, but I want to just say that as we began this work, we thought it would be easier than it was. And I think Kimberly would probably shake her head yes on that. We knew it was going to be a challenge, but we did end up getting a significant number of states' data so that we can begin to look at what is going on at the state level. So before we give the briefing on what we actually found out, I'm going to ask Kimberly Belcher-Vidal to give an overview of the NWRA, the registries, what's in them, where they are, and so forth. And then we'll go into the findings of this report. So Kimberly, I'm going to give it over to you.
Okay, thank you, Linda, and to the Bipartisan Policy Center for an opportunity to both introduce the National Workforce Registry Alliance, as well as our members. We've been working as a nonprofit for about the past 14 years, to help strengthen the nation's early childhood and out-of-school time workforce. Our mission and vision are listed here, but I think we can summarize it by saying at the NWRA, we believe that to reach all children with quality care and education, we also have to reach all members of the workforce with recognition, support, and compensation that cultivates their inclusion and belonging. So in that effort, the NWRA is working to strengthen the workforce registries with quality standards, technical assistance, and professional development. The NWRA acts as the coordinating, convening, and unifying umbrella for state registries nationwide. We provide standards, policies, and best practices regarding workforce support and data quality. So through the technical assistance, we support states in pursuing recognition for meeting standards for data quality or for training transcript alignment, as well as leadership development and networking opportunities. For example, the past 20 years, we've held an annual conference, which will be held in September this year, and we're hoping that you'll join us. We will be co-hosting for the first time with our friends in childcare licensing. We'll go to the next slide. So we are the membership home to 44 states' early childhood professional registries and their staff, as well as numerous national allies. Those registries collectively support over 2.7 million members of the early childhood and out-of-school time workforce. They provide access to over 1.8 million people in direct care roles, serving as both the home and the hub for the early learning workforce. So in that capacity, they are providing early childhood workforce members with recognition for qualifications, support services to grow their competencies, and they administer professional development functions like training and trainer approvals. The powerful byproduct of their collective efforts is then that ability to track and report on the workforce, which enables this really valuable longitudinal data set. So this interactive map that we're showing you here is available on our website. It shows you which states are current members of the NWRA. The ones that have a teal or dark blue color are the states who have obtained our PER recognition, which means they have completed a self-study and provided evidence that they meet our data quality assurance criteria. You can learn more about each state's functions, which data elements they collect, their users or their members from their profile on our website. Next slide. This is what our state profiles look like. So these were last updated in 2023 with the assistance of each registry to help us ensure our accuracy. So once you get there and you select, you can either look at them digitally or you can download a PDF. You can see all of the information about each registry for each state. Last month, we compiled all of those profiles in a handy landscape tool. So if you go on our website, you can access that publication there, but it does allow you to do comparisons across data elements, system functions, as well as the users who are in that system. One of the maybe more prominent examples of our work and contributions of the registries is in odd years, we facilitate an aggregate workforce data set. It's something that we hope will be considered a source of workforce data. States who go through that process then have their data, have met those quality criteria and have their data pooled. Let's see, we've been doing this for about a decade. And then when we get done doing that, we have a report that can be found on our website. So in 2023, we had 16 states participate in that aggregate data set. They were able to represent over 642,000 members of the workforce who are in a direct care role. By 2025, we hope to have close to 25 states participating and a data set that is reflecting closer to 800,000 members of the workforce. But because this was an even year, we were pleased to support this first of a kind opportunity for all registries to contribute summary data about the workforce. This is something we hope we get an opportunity to do again in the future, and is certainly a step towards the workforce census that we dream of. So with that, I am happy to introduce Deanna Diaz, who's going to tell you more about the report, the findings, and our recommendations. Deanna has been a member prior to joining the NWRA. She was an active volunteer on different committees and a member of our executive board. Deanna has also served as the New York Aspire Registry Director and Senior Director of New York Works for Children. We're very pleased to share this report with you today. Deanna?
Thank you, Kimberly. It is truly an honor to present the findings of the report today. As Linda stated, to closely examine who is represented in the childcare workforce, we present today an analysis across the states utilizing state workforce data. While the report also outlines what is not known, trends across the states in their data collection efforts, it showcases examples of innovative solutions to facilitate system supports and concludes with a set of policy recommendations. Next slide, please. BPC released 2 resources for the childcare field to help federal and state policymakers, researchers, and advocates better chart the course toward building a competent and a stable childcare workforce. Well, this year, the NWRA also published 2 resources. One is a landscape report to understand the current state of registries with a comparison of state and territory functions. The second report is a brief with an updated definition of a workforce registry. It also includes a breakdown of the functions that are built within registries to support career pathways, compensation, and workforce well-being. So we invite you to download those resources and read them. Next slide, please. Okay, understanding the childcare workforce. BPC and the NWRA extended an invitation to all states to supply their workforce data. The NWRA contacted all states and DC with an invitation to participate in the report. BPC followed up with 8 states who were non-responsive or who declined to participate. Well, for the purpose of this report, the data parameters were individuals in direct care roles, inclusive of center-based directors and assistant directors, lead and assistant teachers, family childcare owners and family childcare assistants, and trainers and coaches supporting the field of early childhood. Next slide. Okay, let's talk about the findings. In terms of workforce size, we know that there are, as Kimberly mentioned, 44 registries. The state of Florida has registries in 2 counties, but they represent collectively a total of 43 states, in addition with a registry in DC. The registries, as Kimberly also mentioned, collectively collect about or include about 2.7 million members of the workforce. They not only collect data about the workforce, but they also support the workforce. And we know that about 1.8 million professionals work in direct care roles. We also know that in 23 states that are licensing requirements for all staff working in licensed programs who have a registry, to have a registry data profile. Due to this rich data collection, and as a result of these efforts, this is the first time that a set of 10 workforce data points have been identified to examine across the states. Well, although more than 100 fields can be tracked through workforce registries, BPC and the NWRA selected these 10 basic elements: workforce size, workforce by age of children they served, workforce age, employment status, gender, highest level of education, in addition to CDA or any other early childhood credential attainment, years of experience in the field of early childhood, race, average compensation disaggregated by setting and role, and access to benefits through their childcare program. Next slide. Across the states that include both registry and non-registry data, we learned that over half of the states do not collect or reported on the ages of children served by the workforce. In nearly 1/3 of the states, data was not reported or collected on the age of individuals in direct care roles. Understanding the ages of individuals in the workforce is crucial to identify needs of recruitment and for career pathway design, and also to support retention. In addition, in nearly half of states, data was not reported or collected related to the employment status of individuals. And we know that understanding whether individuals are working full-time or part-time is important to fully capture the composition of the workforce, and also to assess, as Linda was mentioning earlier, staff capacity to offer quality early learning settings. And in 13 states, that is 26%, or 1 in 4 states, gender data was not collected or reported. Next slide. Okay, in terms of education attainment, for the purpose of this report, the data collected included the highest level of education, which is an element reported by most states. However, in half the country, 25 states did not report whether or not their associate's, bachelor's, or master's degree is specific to early childhood education. In 18 states, data was not reported for the CDA or other early childhood credential attainment. We know this information is crucial to design appropriate career pathways and to support a well-prepared, well-supported, and well-compensated workforce. In nearly 2/3 of states, data for total years of experience in the field was not reported. And in terms of demographics, the 2 data elements collected here, race and ethnicity, was not reported or collected in 13 states. That is over 1/4 of states. Next slide. In 31 states, hourly wage information was either not reported or not collected. And in 39 states, over 75%, or 3/4 of states, there's no data available related to the number or percentage of programs that offer benefits to the workforce. Next. Data matters, but why? But we know we need accurate and complete data that is consistently collected across states. This data is critical to providing in-depth information about those working in childcare to inform policy strategies, develop cost estimates for needed investments, determining eligibility and distribution of grants. In essence, without comprehensive workforce data, it won't be possible to effectively build professional development systems, to develop career pathways to recruit and retain the workforce, or to conduct an analysis of the cost of services and workforce support needed in each state. Next. The report identified the current investments to collect workforce data, and those include the Child Care and Development Block Grant, with a law that requires 12% of funds to be set aside for quality-related activities, including the funds transferred from TAMP to CCDBG. States have nearly $1.5 billion in federal funds available to strengthen the quality of care. While investments in the workforce, including data, should be a priority for the use of quality funding. As you will be able to read in the report, there is rich data representing the EC workforce, and this data plays a crucial role to support PD systems frameworks, quality initiatives, but also for transparency and accountability of public funding. As demonstrated in the report, workforce data is primarily collected through the registries, but it's important to hone in that the creation, the maintenance, and update of state workforce registries is an eligible use of federal quality dollars. Next. We have come to the last section of the report that ends in a set of recommendations from BPC and the NWRA, starting to the federal government and to states to ensure that workforce data helps to support the state's professional development framework and increase access to high-quality early learning settings. I won't be reading through all of the recommendations, but I will be pointing out to one for today's session. Starting from the Department of Health and Human Services, Office of Child Care, one of the recommendations include to issue a policy statement outlining the minimum information needed about each state's workforce. At a minimum, include the 10 basic data points and standard role definitions. Next. Recommendations for states. One that I would like to highlight today, although it's really hard to choose, will be supporting a workforce registry that includes all individuals working in regulated license programs, capturing all roles and settings and at minimum collect the 10 data points identified in this report. Next. Well, this concludes the overview of the report, and I know I have shared a lot of data and information, but we all know that without quality comprehensive data, it will be nearly impossible to answer key policy questions, much less understand what our workforce needs. We hope this report supports states with establishing or strengthening the collection of the core data elements needed to understand the characteristics of the workforce, help the state CCDF administrators and state policymakers see how their workforce data collection compares to the 10 key data elements selected, and to leverage this data for policy implementation and increase of investments in registries. Thank you again, and now I have the pleasure to turn it over to Linda for the next part of the session today.
And thank you, Deanna, so much for that comprehensive look. And I will note to the audience that we will be posting the report on our website today. So if you're interested in looking at this, one thing we didn't note is that there is a state-by-state sheet on every state and what we found. And you can read exactly how much data we were able to figure out state by state of the states that participated. Now I want to turn it over to Kara Wente, who is the director of the Ohio Department of Children and Youth. And I think as we went through this work, we were looking at, well, what states stand out as actually having really interesting, comprehensive, great data. And I have to say that Ohio was such a standout that we asked Kara to join us with this and talk a little bit more about the Ohio registry, a little bit about why you have invested so much in it and what it's doing for you. So Kara, I'm going to turn it over to you.
Sure. Thanks, Linda. And thank you for the opportunity to be here today. Certainly, we are excited to share information about our Ohio Professional Registry. This investment started a long time ago. After CCDF reauthorization and having to do background checks, we took the opportunity to look at our registry to say, could this be something that we could leverage to create an efficiency? Could we leverage the registry to have every professional have a profile to not only elevate the work of these professionals, but also to streamline and make sure that we could review these profiles and their degrees and credentials as quickly as possible from a licensing and monitoring perspective. So early on, we required through our licensing regulations that every professional in a licensed program had to have a profile in our registry. That way we could do their background check through the registry, we could track their training. We do have a 2-year professional development certificate that is required through our tiered quality rating and improvement system. And this allows our licensing inspectors to very quickly go to that provider to look at all of the professionals listed under that license number and to see if they are meeting all of the regulatory requirements. But then the pandemic hit, and we very quickly knew that we needed to have good data on our workforce because we were being asked questions around if the vaccine rolls out, how are we going to prioritize our workforce? And how are we going to make sure that our child care professionals have access to that vaccine so they can continue to take care of our workers that were essential to the running of our state? So we were looking at the professional registry as the source of truth for our workforce data, and we're able to create a certificate, if you will, that our professionals could take with them to get that prioritization for vaccines. What we also realized very quickly is that when the pandemic hit, childcare was a critical resource to our communities. And we were able to make sure that those professionals felt that priority through also something we called hero pay. It was a retention bonus for staying with us during a time when there was so much uncertainty. And certainly in every step of this work, we saw our registry data become refined. What this also allowed us to do is to have real conversation around how many people are we impacting from the professional standpoint when we make changes to professional development or when we have to look at what a closure would look like. It gave us concrete data like other industries had to sit at the table and talk about how we need to invest to make sure that we're stabilizing this industry along with all others. What we also very quickly realized is that if we had this data and it was so clean and so accurate, we could also start to get information like, what is our turnover? What are we investing in? What could be our savings if we really invested in our professionals to not lose them every 2.5 to 3 years? Could we start to look at wage data? So we embarked on a project through some of the federal dollars that came through to say, let's take our registry and really put a platform and a dashboard on top of it that would give us readily available data to look at our workforce. What we very quickly realized is what our fear was, that we had concrete examples of our turnover being more than 30%. And that allowed us to go to our General Assembly and to our governor and say, look, if you don't have kids currently in a childcare setting, imagine what it's like that every 3 months or every 6 weeks, your child is seeing a different professional in that setting. Imagine the transition and the inconsistency that's creating. It gave us also data when we said, we need to put this money, our stabilization grants, we called them stabilization grants with our one-time ARPA funds. When we said we need to get this money out to our providers as quickly as possible to stabilize the industry, we could see the wage increase. If I go back and look at the 2019 wage, we were at an average income of $11.92. That was our average wage across all professionals. In January of 2024, it was the first time that average wage hit above $15. To me, that showed that our professionals were getting those one-time funds and they were investing it into their workforce. It allowed us to make different decisions, not only when we were doing those retention bonuses to see if it really kept our team in place, but it also allowed us to see that if we invested into our base rates and if we invested into our programs, it was going to directly go into the workforce that we were trying to support. We took this a step further, and it actually allows us to get an average wage by position. So assistant teachers, lead teachers, professionals, substitutes, floaters, because we knew that there was a discrepancy. But then when we were trying to go for grant funding, it allowed us to really want to put some guardrails in to say, we want our assistant and lead teachers to be starting at least $17 an hour. And if we're going to give you the grant, then that's an expectation, and we can see how that looks. And then we can start comparing these programs to others that weren't afforded that grant opportunity. We could start to compare what our retention rates look like from childcare centers to family childcare. It just gave us the data that we needed to know where we should invest and if our investments were working. Most recently, this data has allowed us, when companies are coming into the state and they're looking to see if it's a viable place to put a business, to see if childcare is available. We actually have it connected to census data, so we can look at what is the census population showing us for that county or that zip code, and what does it look like from a licensed capacity standpoint for childcare in that same area. So it's the registry has grown over the last, I'll say, 10 years. Just in its robustness and rigor, and the data continues to get better and better, but it also allows us to just be in different conversations with concrete examples of why this work is so important and why investing truly does make the difference.
There we go. Thank you, Kara, so much. I know everybody in this audience is probably wishing they lived in Ohio right now. That what you have done and what you know about your workforce is absolutely amazing. Now I want to turn to our second presenter, Dr. Walter Gilliam, and we have to put a plug in that Walter is in the White House. That's the interesting background that he's in. So he's there for a meeting and still trying to make this webinar work. So thank you, Walter, for that. We know that the Workforce Registry Alliance and the registries themselves are a really rich source of data. you have used during your time during the pandemic, the registry's data as a source of research. Can you tell us a little bit more about how you did that, what you found, and your impression of the data and how we really can use it moving forward?
Absolutely. Thank you, Linda. And thank you for hosting this conversation about the registries and the power of the registries. So I'm going to tell a little story that builds on some of the points that Kara Wente just said. Once upon a time, the entire planet was plunged into a global pandemic, and that included childcare. And we needed childcare programs to be able to stay open under safe conditions in order for other people to be able to go to work and for the economy to be able to go forward. We all knew that. But what we didn't know at the beginning of the pandemic was whether it was safe to keep childcare programs open and under what conditions. And it just happened to be that about half of the nation's childcare programs had been closed during the first 3 months of the pandemic, and the other half had been open in various degrees. And that gave us an opportunity to be able to see whether exposure to childcare put people at a greater risk of getting COVID-19 and at a greater risk for COVID-19 complications. And it was a brief window that we had, because eventually these programs were going to open back up. And so we needed to be able to collect the data immediately. But we also knew that we needed to have an incredibly large sample, and we needed to have it right now in order to be able to answer a question like that. And there was only one place that anyone could possibly go to be able to get literally tens of thousands of early educators to participate in an emergency study to see whether or not childcare can reopen and under what conditions. And that place was the state childcare registries, coordinated by the National Workforce Registry Alliance. It was literally the only option for doing a study like that in that moment. And so I remember contacting 3 months into the pandemic, Kimberly Beltrip-Vidal, who's here, and Kelly Smith, who was her board president at the time, also from Ohio. That's another evidence of how much Ohio leads the way. And they jumped on board immediately. And we were able to get literally 80-some thousand early care and education providers to participate in a study to see whether or not exposure to childcare increased the rate of COVID-19, COVID-19 complications. In the process, we also collected information about their mental health status, their employment status, other types of stressors, the impact of the pandemic on young children, what kind of precautions they were taking, to study the effectiveness of certain precautions. Kara mentioned earlier vaccination. We collected information about vaccination status, vaccination hesitancy, and we were feeding this information in live time to the CDC, to the National Institute of Health, to the Administration for Children and Families, in order to be able to shape policy around safe reopening of childcare. And all of that would have been possible only through the registries. In many ways, and I mentioned this to Kimberly at the beginning of the pandemic, in many ways, the registries are the closest thing that the field of early care and education has to an emergency broadcast system. In the middle of a pandemic, when we need to be able to find those who care for our children, it is the registries that can find them. And it is the only way to find them. Many other professions, we license those individuals. We can find them through licensing. But in childcare, we don't license the childcare professionals. We license their building. And in a pandemic, we can find the building, but when we scattered the workforce, the only way to find the workforce is through these registries. And the fact that they exist at all, considering how we don't really have any national system for funding them, that there's no specific requirements for them, that they exist in large part because of the charisma and the willpower of individuals within states, is an amazing, amazing thing. But it's a terrible way to have to build a system. We need to do better in terms of knowing who it is that cares for our children, so that in times of emergencies especially, we can find them.
Okay, well, thank you, Walter, for that. And I do love the description of the emergency broadcast system, because that was exactly what happened during during COVID. And I remember being surprised myself when I was talking to a state administrator, and she had a very well-developed registry, and she could actually say, yes, I can get to every person working in childcare in my state. And I was blown away that that was absolutely fabulous information to have. What we're going to do now is go back to a panel discussion on this. And I have some questions. And at this point, we want to invite the audience, if you have questions, to please put them in the chat, and we will try to get to as many questions as we can from the audience. But I want to start out by asking you, Kara, I think we have an idea from your description of what motivated you to engage in this in the beginning, but what advice would you have for other states that clearly haven't figured that out yet? What would you say to them?
Yeah, I think if you're worried about what the data is going to say, don't. Because having it will be such a powerful tool. You will be able to argue for any investment with real data, and you'll be able to show that the investment either works or that you need to course correct. I think your professionals at first will be uneasy, but they'll also see that this is a true way to recognize not only that they're important, but that you recognize the professional development they do, the training they do, the fact that they are keeping kids safe every day, and just overall, it elevates the importance of the work.
Okay, Walter, I have a question for you. Obviously, we benefited during COVID from your ability to do the survey work that you did. But what do you see going forward now as what else can we use the registry data for, especially when it comes to research?
Well, there's a lot of things that we need to know about this workforce. I think it was already said earlier that if you care about children, then you have to care about those who care for those children. Our children's cups are only filled to the degree that some caregiver's cup is overflowing. We need to know who it is that's caring for our children, but we also need to know the well-being of those individuals and how we support that well-being. We learned 3 months into the pandemic that 46% of our early care and education workforce nationwide were reporting a level of depression that could be diagnosed as depression. 46%. And then by 18 months into the pandemic, 46% became 56%. 2/3 of them with moderate to severe stress to a degree that it could compromise their health. Very high levels of moderate to severe asthma in comparison to women in general in the United States. These are important things to know about this workforce. We also learned that a significantly large proportion of them experience relational aggression in the forms of racism as part of their regular lives. And we also know that that was especially true for African American childcare providers and Asian American childcare providers during the course of the pandemic, and that too affects their well-being. That if we really care about our children, then we must care about those who care for our children. And when we know that those who care for our children is a workforce of about 96 to 98% women, that in their work, they are hourly workers in most places, that their pay is highly vulnerable, that they live with massive amounts of stress, that oftentimes we pay them so poorly that they can't even afford the housing that they deserve to be in, that in many cases, we're talking about women who are unfortunately in America the target of domestic and community violence at higher rates than men, that in many cases we're talking about women of color in this industry, and that women of color are oftentimes going to be the targets of racism. For us to know that about this demographic and not collect the data necessary to protect their health and well-being means that we are dehumanizing them and not thinking of them as humans. And we need to think about them as humans if we want to think about the children in their care as humans. Our children will only be cared for to the degree that we care for those who care for those individuals who have devoted their lives to the care of others and the children of others. And I think that in and of itself is an important reason for us to know who this workforce is, so that we can make sure that we're thinking of them as the wonderful, amazing, complicated human beings that they are, so that we can make sure that we are supporting them economically and in terms of their health and mental health and general well-being.
Thank you, Walter. And I think that's so important. Can you just say quickly how many people responded to your survey? I think that was absolutely amazing when I heard how many.
In the first wave, about 82,000, and now over multiple waves, we have over 126,000 unique individuals responding to these surveys. And in many cases, when they responded in the free response section, they would say things like, "Thank you for collecting data about us. It made me, when I filled out this survey, it made me feel like somebody cared about me." You know, just the fact that people would respond in that number is amazing. The fact that they responded in that number because it made them feel like we cared about them is also an amazing fact.
That is an amazing response rate, though. I mean, that's just unbelievable. Kimberly, I want to go to you now and ask you a little bit more. You know what it takes to have a viable workforce registry. Can you tell me a little bit more about what investments are really needed in this area so that we can get this right in every state?
Sure. So if we're talking about, what it takes to have a robust registry or like a comprehensive data collection, I think we have to think about registries in a holistic way. So broader than just the data collection, there are at least 5 components that registries or sort of 5 layers to that data collection, right? So there's the engagement component where you have staff who are doing outreach and supporting with navigating the system and data intake. You have communication specialists who are supporting bi-directional information exchange, like Walter just described. You have customer service, and if you move from that into the programs that registries administer, so these are the support services: eligibility determination, access to, sometimes they process, sometimes they administer programs like scholarship, wage stipends. So you've got that group, and then you have the heartbeat of what we're talking about today, which is the data collection. Again, a byproduct of those first 2 components. But within that, you need staffing to do data verification, data cleaning, data analysts. And then we convert that into usable knowledge, right? So then you need another group of people who are supporting the data entry and the researchers and the partnerships to help mobilize that data over to policymakers so we can have informed decisions. So when we talk about this collective of data, it takes first a very robust staff. So that collective team is part of this cyclical information exchange. But I think when we talk tangibly about what's missing in terms of investments, first, if we talk data quality, we want to talk about representation. So does the data have adequate saturation so we have confidence in what it's telling us? That requires a policy investment. So are the policy partners requiring participation of the workforce? In almost half the country, it's still voluntary to participate. So we need program support, we need state administrators, we need that policy effort being made. The second thing we can talk about is while registries are uniquely positioned to support self-reporting, self-management of data, they're also verifying that data. So when we talk about data quality, again, the staffing being able to have a full, robust data collection, that rests on having a fully funded registry. So the funding issue is very sensitive.
Mm-hmm.
I think the third thing that we're really missing, and what Walter sort of spoke to, is we need a vision for the workforce, a collective commitment to what our objectives are to support them. And it can't just be data collection or programs about what we want from them. It needs to reflect what they need from us. So that vision sort of contributes to creating data dashboards or pathways that we measure our progress against. I think those are probably the 3 big things.
Okay. We have a follow-up question from the audience, and Kara, this one is for you. It asks the question about, and I think this follows on to what Kimberly was just saying, was the funding for the Ohio registry provided all at once, or did it ramp up over time? And was that a legislative decision or a state agency decision?
So it was something that we've been investing in over the last several years. The last round of the data dashboard actually did come from the one-time ARPA funds, the childcare funds. We leveraged those, so we were able to do that through our agency authority and didn't have to go through a legislative change. However, obviously, all of this work is vetted to make sure that, one, we don't just do it for our childcare industry. We're actually now looking at how can we leverage these same dashboards for our Help Me Grow home visitors or early intervention specialists. So we're really trying to make whatever technology we build transferable when possible.
When you and I were talking earlier, you talked a little bit about the use of the data for economic development purposes. Can you say a little bit more about that? Because I do think that that's one of the things that people are slow to come to the realization of.
So we are very fortunate in the state of Ohio to have a lot of opportunities with new businesses coming in. One of the questions we're looking at internally, but also being asked, is how much childcare is in that area when they're looking at specific sites. And what we can do is we can look at our census data for children under the age of 6, and we can compare it to our license capacity. So we know when we license a program how many kids they could have there at any one time. It's not a perfect science, but we also know, which was mentioned earlier, that if we don't have professionals to fill every classroom, we may not be operating at 100% capacity. So it allows us, when we get these questions from possible companies that want to come in, or from our partners that are looking to help draw companies in, to answer the question of, is childcare available? And if not, can we look at investing and supporting building up and recruiting and creating access in that space?
Another thing that we talked about, and I'm curious as to this, because I think what we struggle with nationally is the turnover rate. And I've seen it varies widely. What do you know about the turnover rate in Ohio and from your registry data?
Sure. So if we look at an annual snapshot, we have more than a 30% turnover rate. So certainly we can look at that compared to retail, but also my children's service workers. And when we look at that, we can also compare the people leaving to the people staying and see that obviously the ones that are leaving generally make a little less on average. What we also know, though, is that when we compare our settings, what we didn't expect is that sometimes we see our higher rated programs, so meaning our programs earning that highest tiered quality rating designation, actually see a higher turnover. But in another sense, that makes sense, because if they can't afford to pay them a lot more than their counterparts, certainly if I were a lower rated provider, I'd be trying to recruit from our higher rated providers to increase the quality of my program. So we're finding some of that as well, which allows us to make better policy decisions as we're looking to revise and update our tiered quality rating system.
So do you know from the data that you have, and I think one of the things that we struggled with when we did the analysis of state by state is how many of your people in your registry have some formal level of education?
So we do. We can look at our data, and I actually try to look at this monthly, and it remains pretty stagnant. If we look at any of our positions, including floaters and substitutes, that count in what we would consider the child's ratio, so assistant teachers, lead teachers, administrators, we know that about 80% of our early childhood educators do not have a formal education after high school. And having that data has allowed us to make different decisions around what we're going to require from professional development, how we're going to meet our early childhood educators where they are. We know that curriculum is really important for kids to have access to, but it's different when you're talking about implementing a curriculum in a classroom that someone has a 4-year degree, or someone that may not have had experience with teachers. So that's allowing us to make different investments.
I have one more question that I want each of you to think about, and I think it's a really critical one. And given that we have somebody from a state agency, somebody from a private organization, and a researcher on this call, I would like for each of you to think about what is the best way to manage this. Is this the, and when I say that, I mean, is this best through a state agency, through a private organization, through how do we advise states wanting to do this work to get into it that aren't doing it? And I say that because sometimes, and no offense, Kara, that it can be difficult to get data out of state agencies. And so the restrictions on data sharing, et cetera. And Kimberly, you're a private org. I mean, you're a 501c3. You see it a different way. What is the best way for this country to proceed? And I think there's a simple answer, but then it's not actually that easy. So I want to start with you, Kimberly, and your response to that. You see these registries across the country in various places. And what makes the most sense to you?
Well, I think for us, because we do the partnership eligibility review, we do look or examine the quality indicators for data. When we do our data, aggregate data poll, although we are aggregating it, we still hold the data from each state who has pulled that. Now, that exercise in and of itself requires the registry to go through a pull cleaning process. It gets verified and then it gets uploaded. So we have access to that data. So I think there is a way to work with a national organization like the NWRA to create pathways where a state may not be able to give you direct access to data. But again, I'll reiterate this one point. I think because of the severe shortage of staff, registries have not really been equipped to be publicly accessed data repositories. So for kind of what Kara just described, within the state, it may work wonderfully, but for people who are trying to leverage that information, it gets a little trickier. So I think the NWRA certainly can play a role, but I think also making sure you have a well-staffed registry, so you have people in all of those positions to complete that data life cycle is a component in that.
Mm-hmm. Hey, Walter, how would you answer that question?
It's a great question, but it's a complicated one because I mean, like as you said, we have government entities that collect this data. We have nonprofit organizations. I'm at a university. Universities are sometimes the individuals who host registries, child care resource referral agencies, and they can be hosted in a lot of places. But I think rather than trying to think, which is the best place, I think it'd be more useful to think about what are the best conditions. And part of it is, I think what Kimberly said, there has to be enough resources dedicated and available that the data can be collected well, collected cleanly, and safely made available so that people can actually see what the impact of the data are. And then it's in that process that you actually create some degree of buy-in. If there resources to collect the data, but not enough resources to be able to do what was happening in Ohio, where you create dashboards and people can see it, then how do you convince people the value of what it is they're investing in when they can't see the fruits of that investment? So I think part of it is that. I think part of it is making sure that you have the right personnel available that know how to create good surveys, that know how to collect data well, that know how to house data well. Those people exist, but it does take some degree of resources for that. In a perfect world, I think there would be dedicated resources made available through funding mechanisms that fund subsidized childcare in the United States that are then utilized by states in order to be able to create reasonably competent workforce registries that could then be banded together in order to be able to provide common data across states so that we can understand not only within states, but nationally, the well-being of this workforce.
Kara, how do you see this from a state perspective? And then you might describe how you do it in Ohio.
Sure. So we are fortunate to have a great partnership with the Ohio Child Care Resource Referral Association. They actually house our professional registry, not just for childcare, but as I mentioned earlier, our home visitors, our early intervention specialists, early childhood educators. It allows us to do cross training. So one of the great reasons we like using that centralized resource is because we all need trauma training, and now we can leverage that trauma training across industries. It's worked well for us, where our state agencies invest through our association. And then our association allows us to help prioritize, obviously, those investments. And we have deliverable-based contracts, and it allows us to control what's going in and what's going out. And obviously it's our data and it can't be shared without us. So we have a lot of data agreements and data sharing in place already, because we still, own that data. So we don't have that fear of it being released without us at least understanding what's out there. I think that works really well. And it just has positioned us to have different conversations. Our next round of work is going to be focused on how can we better support recruitment and retention, and looking at it across industries, because we have some of that information. So that nonprofit partnership has worked well in the state of Ohio.
Yeah. One other question that's come in on the chat, it is interesting, is have you learned a good process for keeping the data up to date? And I do think that is a really important piece of all of this, is how current and relevant is the data. Kimberly, what about that?
Yeah, so I actually would like to hand this question over to Deanna. I think she's well equipped to answer this one.
Okay, Deanna, it's over to you.
Sure. So we have seen through the evolution of registries that most registries now, compared to, I will say, 10 years ago, there was an annual renewal process, but during that time, there were no updates. Sometimes it was 2 or 3 years. But now most of the registries allow for and have, in my time in New York, our state administrator wanted current data. And so we needed the support of legislation to ensure that at the time of licensing or any time of professional development was attained, that the workforce will keep the data up to date. And so the registry had to set reminders, work in partnership and collaboration with the workforce to understand why the data needs to be updated. But then I just want to recap what both Karen, Walter, and Kimberly have said. It requires partnerships. It takes a village as well. Registries need resources, but also need the support of partners. So training organizations, if the scholarships are not managed through the registry, supporting the registry from the scholarship recipients to maintain the data up to date in the registries. Those training organizations that provide training or trainers to put ensure that the data, and they partner with registries, since most of the registries now do training and trainer approval systems. Rated data like Ohio has, in order for these to work. So if everybody is an advocate and ambassador of registries, then it's easily to do this. And then I think one of the things that, we mentioned all the pieces around funding, is very important for those data systems developers to also be part of this effort. We need easy systems to navigate, especially because registries is a technology. So most of them are online applications. The workforce, they need support. They need systems to work together. All systems within the state to work together to support them. We cannot overwhelm the workforce more, with what they have right now. And so how do we do that? Is by partnering, by investing in technology, by those data system developers to also be accountable for the systems that they're offering. So it's a long answer, it's complicated, but it really requires many places to be taken into account in order to maintain data up to date.
I think at the end of the day, what you've all said is that this is all about partnerships, and that no one person, no one agency can do it alone. Well, we are out of time, so I want to just take a few minutes to thank our panelists, Kara, Walter, Kimberly, and Deanna, for working on this with us. We think this is a great first step in trying to, expose the issue, if you will, encourage states to do more. The other people that did not get mentioned in this are the state administrators who, in many cases, we worked with the state administrators to get some of the data that we used. We know how overworked they are, so we really appreciated their time. And then there are a few people behind the scenes that this was really you talk about a partnership effort between the NWRA staff and the BPC staff. There are some people that have not been mentioned. Caroline Osborne, who started the work with us on this, Olivia Rotolo, who's out on maternity leave with twins right now, Rachel Owen, who was an intern with us, and Grace Reef, who helped us get this over the finish line. So we want to shout out to all of those for the work that they've done on this report. We hope you find it useful. And then finally, a big shout out to Winton Henderson, who did work with us back and forth on each of these state data sheets and on the report itself. These are very, very painful things to do behind the scenes. So it's always, I always appreciate people like Winton and all the work that he did. So thanks to everyone for joining us, and we hope this was interesting and beneficial to you all, and hope you have a great rest of the day. So thank you, everyone. Thanks again to the panel.